So this podcast episode delves into the sensitive topics of gun violence and suicide, recognizing the impact these issues have on individuals and communities. Our intent is to approach these subjects with the maximum amount of care and responsibility. Listener discretion is advised, and if you know someone is struggling, please seek immediate assistance from relevant support systems. This episode is meant to grow awareness and empathy regarding these critical matters and is not for professional guidance. We can all help prevent suicide. The 988 Lifeline provides 24/7 free and confidential support for people in distress, prevention and crisis resources for you and your loved ones, and best practices for professionals in the United States. That's the 988 Lifeline for 24/7 free and confidential support.
Today is October 4th. Welcome back to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen to find out how pharmacists and pharmacy students like me can improve public health, health equity, and patient care through advocacy and education. My name is Jiwoo Lee, and I am a final year pharmacy student at the University of Rhode Island, working with the Rhode Island Department of Health alongside Dr. Bradberg.
And I'm Dr. Bradberg. I'm the clinical professor of pharmacy practice and clinical research at the URI College of Pharmacy and the academic collaborations officer at the Rhode Island Department of Health. The opinions expressed in this podcast by us don't represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
Today, we have an important and timely topic to discuss: gun violence and its intersection with public health. It's a topic that has gained significant attention in recent years, and we aim to shed light on the issue from a healthcare perspective. Gun violence is the most prominent contributor to death in the U.S., killing more than 38,000 people annually and causing nearly 85,000 injuries. According to public health experts, about 60% of gun deaths are actually suicide. More than 600 women each year are killed by their inmate partners using guns, and about 329 non-fatal firearm injuries happen daily in the U.S.
Why don't you pause? You said inmate partners.
Oh, intimate. Oh, my God.
Just start with just like pause and then go to according.
More than 600 women each year are killed by their intimate partners using guns, and about 329 non-fatal firearm injuries happen daily in the U.S. While we recognize the full scope of the issue with gun violence, today on the Regimen, we will be focusing on firearms and self-harm.
So clearly we can't be comprehensive here. A lot of this is to just inform and talk about pharmacists' role. It's a very complex topic. We don't have any guests today, so this is just an introduction. So our goal here is not to provide comprehensive information, because there's many elements that go into this. So we're going to do our best today. So with that said, there's various and complex factors that lead to death by suicide. Firearms lead to a higher completion rate. So considering that 9 out of 10 suicide survivors don't attempt again, it's crucial to restrict firearm access to save lives. We must view this issue as a public health epidemic and work towards safer use of firearms. That's what we're looking for, safer use of firearms. Studies have shown that the presence of a gun in a house increases the risk of suicide for all members of the household. According to the American College of Surgeons in 2016, guns were a factor in over half of suicides and 3 out of 4 homicides. While we've seen a 22% drop in traffic-related deaths since 1999, there's actually been, in that same time period, a 17% increase in deaths due to firearm-related injuries over that same period. It's not just a medical issue. It's a public health problem. It's a system problem. And hospitals and health systems and pharmacists and other healthcare professionals all have roles in trying to prevent and treat it. When we treat violence and firearm-related injuries, or unintentional or intentional injuries, like a complex disease with societal and personal and population inputs, we can use evidence-based public health strategies to tackle it.
So the important question here is, what are these evidence-based medical approaches to the status quo on gun violence and public health? So the Educational Fund to Stop Gun Violence efsgv.org, stated the following 4 actions. 1, define and monitor the problem. Define the violence problem through systemic data collection. 2, identify risk and protective factors. Conduct research to find out why violence occurs and who it affects. 3, develop prevention strategies such as like designing and implementing and evaluating interventions to see why that works. 4, ensure widespread adoption of effective strategies, scale up effective and promising interventions, and evaluate their impact and cost effectiveness. So, how can we apply the public health approach to prevent firearm suicide?
Yeah, and I just want to have another a plug for the Educational Fund to Stop Gun Violence, or efsgv.org. I think you can look at these factors, and as a researcher, I think this is how we define all problems, whether we're preventing sexually transmitted infections or overdose deaths. We're collecting data, identifying risk and protective factors, prevention strategies. But the key is that fourth one, is that there's widespread adoption. What our listeners may not know is that we often have already researched and have data on what the solutions are, where the gaps are, and how to close them. It's really all about implementation, and that's what I focus on. So having the ability to obtain firearms, right, is the substantial danger when it comes to firearm-related suicides. Dealing with this access issue is the crucial element of any strategy aimed at preventing suicides. So there must be policies and programs in place to limit individuals' access to firearm when they have a heightened risk of suicide. So it's not taking guns away, it's making sure that people who are at risk of this of intentional injury through guns have limited or access to these guns. And these limitations can be applied, again, at all of those levels of society. The individual themselves, the house they live in, gun locks, locking up guns. These are things that are supported by 80 to 100% of gun owners. The community, the society, including gun owners, gun shops, and who sell guns, and governmental laws. So we're not saying that it's the fault of the person or the owner of the gun or the family of the gun or the person who sold it or the manufacturer. It's really all of us working together, which I think is always results in a better outcome. Maybe not the one that those individuals look for, but at least there's an outcome that everyone can agree on, which is we need to prevent this 30-year increase in suicides. And from a pharmacy perspective, we actually had a day to remember and increase awareness of pharmacists' increased incidents of suicides. And so this directly affects our profession as healthcare workers, especially in the current pandemic and the effects that that's had on mental health and workloads. But there's a paper that was published in the Journal of the American Pharmacists Association, which, disclaimer, I am associate editor at, that had some of the highest rates of social media exposure, showing that there's an independent association of being a pharmacist and dying by suicide.
Okay, so I really want to underline the fact that historically this multimodal approach has been very successful. So smoking cessation, cancer prevention, car crashes, and these are just the few of them. So the real question here is, why have we yet to use these methods on this specific issue, would you say, Dr. Bradberg?
So it comes down to, I feel like my whole day today has been talking about, if we give people money, if we pay for things, then good things happen, right? So the short answer to this is the opposite, is there's lack of funding, right? So I always say that number one in your 4-point plan that you mentioned, G, is all about gathering data, and you need funding to gather data. You need funding to implement interventions, evaluate them, and then make sure that they're widespread. So I don't know if you've heard about the Dickey Amendment, but this famously prohibited the Centers for Disease Control and Prevention. And you may say, what does the CDC care about guns? But this is an epidemic, and actually they were studying guns 40 years ago in 1983. So they started studying that in 1983. This amendment in 1996 prevented the CDC from using any of their funds to promote or advocate for what they called gun control. I prefer the term gun safety, again, both for individuals and societies, from 1996 to 2021. So even if researchers wanted to prevent and study the issue, they had to look for funding elsewhere other than the federal government.
So it seems like if someone were to identify the gun violence issue and firearm-assisted suicide as problematic, there was no way of really testing the proposal itself due to lack of funding. So this really proves the need for an adequate policy from societal alongside acceptance. community and heighten individual responsibility.
Exactly. So we did this with traffic-related deaths, and I like that you said car crashes. As someone who worked in a trauma ICU, we don't call them car accidents because accidents are preventable. We call them car crashes, and how we deal with the aftermath there. So over the last 50 years, car crash deaths have gone down by almost half. And so what do you think contributed to that, G?
I'm assuming traffic laws, increased awareness, education probably played a role there.
Yeah, all these things, right? So these are standard interventions that seem to work. We evaluated them. There's speed limits. Even one interesting injury prevention aspect is if in New York City, if they lowered the speed limits from by 5 miles an hour, there was some significant drop in pedestrian deaths. So we know that those work. Driving laws, of course, technology. We have airbags, and so we're protecting people in the crashes, but we're also, our new car tells me when somebody's driving by me in my blind spot. I always think, why wasn't this there before, right? So there's still things to do there, which is really the social behavior. I'm sure you've never texted while driving, G.
Definitely not.
Using your fingers. But again, the technology here is that G and I were talking earlier today in my car, and I was voice texting. Still distracted, but it's reducing the risk. Mm-hmm. So again, now it's a social norm to use those technologies if they have access to that, or if they're impaired, they can call a dedicated driver, or they can set a dedicated designated driver, or they can call a rideshare and have them call home. Another fact that came to mind is studies of cities that had when rideshares were coming about, the companies, you are familiar with them, when companies were in a city and not in another city, alcohol-related traffic deaths were dramatically lower in those cities, independent of other factors, size and type of thing for car crashes. So we know that that's a great intervention, and we should highlight that. So this is what we need for firearms, right? We know they're causing problems. We're seeing increased deaths. There's a critical need here to gather this data, to compare it with the idea of if you see a friend, this is bystander intervention here. If you see a friend that tries to drive home after having too many drinks, what would you do, G?
Well, obviously try to stop them and provide other alternative measures here for them to get home safely.
Again, if your friend was recently diagnosed with depression, had suicidal ideation, right? It's your friend, they're sharing this with you. It's our responsibility as healthcare professionals, but also just as people to recognize that and think, what would happen if that person owned a gun? What would be the right thing to do there? We'll
probably talk to them about how it's not the best idea to maybe own a gun in that moment, and ask if they want to seek treatment.
Right. Seek treatment for the depression.
Right.
And be supportive and be in contact. Right. Mm-hmm. So it made it seem obvious or common sense, but we can prevent suicide, and we can absolutely prevent suicides that involve firearms. So this is the exact behavior we need, right? When they see their friends and family members owning guns, there are people who safely own guns and use them safely, and they keep them locked up, and everyone is trained and licensed and things like that. But there still is danger, just like owning a car. You have a driver's license, you have a car that's registered, you have to inspect your car. We do all this with other dangerous things that we were talking about, and we use technologies to make it safer and safer as time goes on. So we need a strong policy in place alongside individual awareness or family awareness to decrease these numbers of intentional or unintentional gun deaths. Policies that work at the population level are called red flag laws or extreme protective laws, things like that. They're more beneficial. In fact, our source of all time, Wikipedia, says it permits a state court to order a temporary removal of firearms, again, emphasis on temporary, who may be a danger to themselves or others. A judge makes a determination. If you refuse to comply, that person refuses to comply, they're punishable with a criminal offense. But then after a time, the guns are returned to the person unless there's another court hearing to extend that period. So as of May 2023, according to Wikipedia, let's take that with the sources that they have, 21 states and the District of Columbia have some form of the law. And of course, there's wide variation between the laws on how these work. So I know that some laws work better in other places than other, but this is how states regulate these things.
Right. So the focus here, everyone, is to protect people with high risk of suicide and provide them with the treatment as a preventative measure with the help of individuals, communities, and policies. Okay, so Dr. Bradberg, where would the role of pharmacists be in the preventative process?
So pharmacists are the most accessible, and I like the term visible healthcare providers. They're one of the most trusted health professionals. We should counsel patients and families about firearm safety, safe storage that we've been talking about, the red flag laws. We're a point of contact for all sorts of things. We're hopefully almost always available when the pharmacy's open or community pharmacy's open. We're in institutions, we're in clinic settings. We may be that person who's the third healthcare professional they saw that day. They saw they saw the doctor, they saw the MA, they saw a nurse, they see the pharmacist. That may be the point where they're like, I have this question. So we just have to be ready to listen and make sure that we're doing patient-centered care here. It's a point that we should be aware of the data we talked about. That's why we do this podcast. Educating patients is important and something to consider when we're talking to them or talking to parents of young children. I know that there are recommendations for physicians when they're talking to people to say, is there a gun in the house? And that one line is proven to reduce the risks of gun injury and death. So you had mentioned the example of the person with depression and who happened to own a gun. I mean, we should help everybody with depression, whether they own a gun or not, but we need to screen people, right? Make sure that we use validated scales and things to evaluate risk for depression, risk for suicide, intimate partner violence, which is a very key and concerning issue, and other interpersonal violence. If a person's talking about suicide, ask about their mental health. Ask about, do you have a gun in the home? Pharmacists should use this high accessibility to monitor patients and identify individuals that may need help. And again, whether it's passive with a handout or with a poster or those types of things, maybe it's just advertising 988 across the country. We can determine that once a person is at high risk of misusing their firearms or self-harm or harming others, we should be the ones to directly, again, actively or indirectly or passively provide them with medical care, referral to services as soon as possible.
Right. I also think it is very important for us, healthcare workers, pharmacists, nurses, everyone, to be able to really openly talk about suicide with our patients. Like, if you think about it, we're probably like the best people for them to really like express their opinions to in terms of suicide, because we're like literally the people that can prevent it too and navigate them to the resources that they require. Also, we must develop a comprehensive curriculum where pharmacy students are taught on. Let me do that again. Moreover, we must develop a comprehensive curriculum where pharmacy students are taught on how to talk about suicide with the patients and how to identify patients that possess suicidal ideations.
So that's all we've had here today. We hope that this has been educational and informative, and people can think about people in their life they care about and how they can help.
So if you enjoyed today's episode, please take a moment to subscribe, rate, and review us on your favorite podcast platform. Your feedback helps us reach more listeners and continue to produce great content.
And if you have suggestions for future topics or guests you'd like to hear from, don't hesitate to reach out to us on social media or through our website, through any of the podcast platforms. We're there for you. But we also advertise each episode on social media, on LinkedIn and X, formerly known as Twitter, Instagram. You can find us on our handle at PharmD_Pub_Health. That's farm like pharmacist, PHARM, D, and then pub, P-U-B, pub health, right? So it's at PharmD_Pub_Health on Instagram and X. We love hearing from our audience and always excited to produce more great content.
As always, thank you for listening, and we can't wait to have you back with us on the next episode of The Regimen.